Well, the fight against COVID-19 is a long way from finished, but next week will be the turning point. On Thursday, December 10th, the FDA will consider emergency authorization, or EUA, for the first COVID vaccine, which Pfizer developed. Then next Thursday, December 17th, it'll consider authorization for the second COVID vaccine, which Moderna developed. And here's what happens next.
And within 24 to 48 hours after submitting their EUA, we, from a federal perspective, have promised and have set everything up so that we can quickly review those EUAs and hopefully start sending out vaccines, again, within 24 to 48 hours.
That means the Fed should approve the Pfizer vaccine by this coming Friday or weekend, and the same goes for the Moderna vaccine the following Friday or weekend. Both of these vaccines use messenger RNA. In layman's terms, they make our bodies think they've been infected with COVID-19 when they haven't, so they build up defenses to ward off the real virus. Other vaccines in stage 3 trials should be ready the first part of next year. And the federal government's goal is to have it all widely distributed to the general public by spring.
If you're part of the public, I want you to understand it'll probably be end of first quarter, beginning of second quarter next year before you can get a vaccine.
That's because supplies will be very limited at first, and the government is reserving the first phase for groups who need the vaccines the most.
We want to make sure those first vaccines, the first weeks, go to those most vulnerable, those where you have the biggest impact on saving lives.
So this week, the CDC's experts voted to put residents in long-term care facilities and frontline medical workers at the front of the line.
I do think we'll have about 40 million doses of vaccine before the end of the first year of the year. That's enough to vaccinate 20 million people.
And Governor DeSantis said at least 1 million of those first doses are heading to Florida.
Florida's share would be at least 1 million, maybe as much as 2 million that we'll be able to do. And if you're applying that on key areas, that's going to make a big difference.
With a 2-dose vaccine, that means that Florida is in a position to vaccinate 500,000 to 1 million people in the first phase. Medical staff will get the shots in the hospitals where they work, and nursing home residents will likely get the shots where they live.
Trying to transport all those people from the long-term care facilities, and especially during a pandemic, gets a little cumbersome. So it's probably easier for us to go there than them to come to us.
And the state has already lined up partners to make it happen.
So we've been working with CVS and Walgreens, who have contracts with the federal government, for them to go in and do this.
The state's vaccine plan is considered a draft at this point because it can still change based on additional guidance from the federal government. But it shows starting this month, the state will have closed pods or points of dispensing. That means closed for priority groups and only in a certain order. That's hospital personnel or healthcare workers most likely to be exposed to the virus, long-term care residents and staff, followed by first responders, and then other targeted priority groups. Those priority groups include other healthcare personnel, essential workers, people with health issues that place them at higher risk of severe illness from COVID, and/or senior citizens. Now, the state defines essential workers as it did during the stay-at-home order in April. That includes certain workers in food and agriculture, energy, transportation and infrastructure, communications, and critical manufacturing. Meanwhile, the state says it's working with doctors to figure out which patients have underlying health conditions that put them at heightened risk. And it's already compiled data on 4.3 million senior citizens across the state, complete with data mapping that shows their locations to manage the proper shipments of the vaccines. After these priority groups are vaccinated, pharmacies will play a key role in giving shots to the general public in a way similar to annual flu shots. The state also notes plans to use drive-through vaccination stations similar to those established for COVID testing.
So hang on just a little bit longer. Understand that the science out there has never been stronger to support the wearing of masks. You shouldn't have to have a mandate to do the right thing, to protect your neighbor, to keep schools open.
And that's critical to slowing the spread of the virus and saving lives until the vaccines have reached the general public and until we all finally reach the end.